Hello, everybody. Welcome to Community Spotlight hosted by CASA of Tulare County. I'm Alberto Ramos, the Executive Director at CASA, and I'm here happy to be joined by our friends at Tulare County Health and Human Services Agency.
And a lot of people think it's just the volunteerism, right? But you mentioned it and you touched on it earlier, but the processes and how we connect those, I just go back to like the court system, right? The judges get reports from CASAs and they get reports from their social worker. And so in comparison, those reports shouldn't be far off from each other, right? We should be in enough communication and changing that, not to say that it's always been on a bad lens here in Tulare County. I don't think that's been the case, but bringing those things to the table and having open and honest conversations when we do miss the mark on something so that we know how to move forward together. And recently, I think we've gotten some compliments on that side to say, like, good job in making some of these changes, because the other goal is to not cause other people on the other side of the decision-making process more time, energy, and confusion on what happens next with this child and family.
Definitely.
Well, what are some of the needs that I know resource parents, formerly known as foster parents?
I think the ultimate goal, and we're getting ready to release a series of videos around what child welfare is and what child welfare isn't. So we hope that the community takes some time to watch those as well and do some engagement with us in that avenue. But I think one of those is we really want to focus on family maintenance and family reunification. Our goal isn't to remove children from home and unnecessarily. And if we have to remove a child, our goal is to return them when at all possible. It's not the goal to keep them from them unless that's an absolute factor that we have to follow. And so really looking at resource parents, foster homes that are adequate for children, and looking at safety factors here in Tulare County. The hope would be that if and when we have to remove a child, we can place them as near to their home school as possible and those kinds of things to really limit the number of additional impacts outside of being removed from their home that they have to experience, like changing schools or continuously changing homes. So, I mean, if I had to ask for one thing and wave a magic wand, it would definitely be one, that we wouldn't have to remove, but two, that we would have more resource families in the pool.
So people out there, if you're listening, if you can't become a CASA, if you'd rather be more in a parental role, being a resource parent is an option. Sorry, Gilberto, you were going to say something.
One of the things that we want to look at is a lot more education and outreach and engagement with our community on the importance of reducing, eliminating child abuse and neglect, and how important it is to ask for help, whether you're a brand new parent or a fourth-time parent that maybe has a child with special needs. And each child is unique and each child is special. And so they all come with their set of challenges, opportunities. And so that's one of the things that I would like is to really highlight and to help our community to be part of that piece, right? We need everybody. I was just having a conversation about how when we were growing up, a long time ago, it seems like, if you did something at school or something happened, by the time you got home, your parents knew. Your parents already knew about that, and so more. Obviously, we need more of that. We need more where everybody is looking out for each other's kids and well-being, and if we can work on that, if we can work on stabilizing our families, however that may look like, whether it's relatives, whether it's resource parent, whoever the case may be, that child is in a loving, structured, stable home that is going to help them fulfill and grow up to be the best that they can be. And so that's my goal with child welfare.
Fantastic. I think something you said I wanted to emphasize this point because the foster care system is intended to be a short-term thing, right? We don't want kids lingering in foster care. We don't want families to be disconnected. It's better for our society that these parents are in a healthy state and be able to provide the safe and nurturing environment their kids need, right? So I want to highlight that to people watching, listening, that this is not a punitive system. It's not like designed to get people in trouble. It's designed to fix something, right? There's something's broken. Let's fix it. Let's get this family back together in a safe manner, right? And so I hope people can have that compassion. Like, this is not about, oh, something bad happened to these kids, they can never see their parents again, right? That's not the approach we should have. It needs to be, what do we need to do to heal, right, and get back together? Because I think I want to highlight that point, because it's too easy to get into that mindset of this happened, and let's almost like
Final.
right,
Yeah.
so
Yeah.
I thought we should touch on that before we bring.
And I think the goal for behavioral health is to provide, we talked a lot about prevention and education, and that's what a lot of therapy is psychoeducation, of educating parents on doing things a little bit different. You talked a lot about kids are all different, and they are. And so, with behavioral health, we want to be accessible for families to access our services before it gets to the point where there's a crisis, before it gets to the point where there has to be an intervention and a disruption in the family structure. And so that's the goal of behavioral health. The worst time for a child to enter in a behavioral health system of care is in a crisis. And we saw that a lot in the pandemic, where kids that were stuck at home, not going to school, our crisis went up 168%. We were unfortunately putting kids in a psych hospital that had never been in behavioral health before. And what a horrible way, right, to access services. So our goal is to partner with CASA, with child welfare, with all of our community partners. We can't do it alone either. And so we value the voices at the table, especially when we do consultations and child and family team meetings. That is definitely the goal for behavioral health.
Well, thank you for being here, taking time out of your busy schedule to come chat with us, and thank you all for paying attention and